Hello and welcome. We are excited for you all to be here and to hear from uh, Renee and Wendy about coaching in healthcare. My name is Suzanne Currier. I am the president of ICF Virginia. We are celebrating International Coaching Week this week and excited to have this as one of our panel sessions. And as part of the International Coach Federation, we are part of the global organization of coaching, and the ICF globally is an organization with 60,000 plus members around the globe and in 150 countries. And we here in Virginia are a statewide chapter of credentialed coaches, coaches in training, and coaching curious. Those are those who are interested in the coaching profession. And we exist to elevate the coaching profession in the state and offer value to our members and those they serve. And today is an example of that. I'm excited to hear about coaching and healthcare. We as a chapter have had some relationship locally here in the Hampton Roads area with Children's Hospital of the King Daughters, CHKD. We've been delighted to offer some pro bono coaching for them over the years. And our chapter on our LinkedIn page actually just recently launched a little article where we interviewed their talent development manager there, who is piloting how to include coaching as part of their leadership development for the CHKD professionals and people managers in their organization. So I'm excited for this conversation today. And with that, I will hand it over to Wendy to kick us off. And I will be off camera, but behind the scenes helping with chat. So if you have any questions along the way, feel free to drop it in chat and I'll make sure that that gets to everyone. Thank you, Wendy. Thank you, Renee.
Thank you so much, Suzanne. It is wonderful to be here. And I will also just put out a big plug to have you in the background doing all of the tech work, because that is like the biggest thing with all of our webinars. So thank you so very much. It is a pleasure to be here with all of you today. And I really appreciate being able to welcome my friend and colleague, Dr. Renee Morales, to join me today as we're going to be going through the evidence and the return on investment for coaching in healthcare. And really kind of touching on a lot of the questions that we hear folks asking about coaching, about the benefit for individuals and for institutions. So I'm going to put it out there along the way that Renee and I are welcoming a conversation. And so we welcome you to look at the chat box and to be able to become acquainted with that. And we will dive in right away. And I'm just going to give you an opportunity to say hello as well, Renee.
Hello, I'm so glad to be here. This is really, really exciting for me. I believe that Wendy was talking to Suzanne prior to us coming, and Wendy and I are actually neighbors in Virginia, in Chesapeake, Virginia. And so she is a dear friend of mine, and we're really, really glad to be able to bring this presentation to you.
All right. Well, with that, you're going to hear a lot of the love and the mutual respect going on here. And we're also going to be bringing on the all the information. So how about this? I trust that everyone can see my slide. Can you just give me a quick confirmation that you can see that?
I can, as the host, maybe someone
Thank you.
in the chat. Yes, we have someone in the audience who can see it. So thank
Bless you. Thank you. See, you all are running my tech checks for me. I need you all in my life. Okay, so let's dive in. Again, we're going to be talking about the evidence and return on investment, and we'll get into all of the full introductions here very shortly. So just starting off with kind of an icebreaker, what is your interest in coaching in healthcare? Please, I welcome you to drop your inspiration, if you will, in the chat box. What is it that brings you here today? Whether it's something for your own personal interest, perhaps as a physician, perhaps as a coach, perhaps as a healthcare administrator, perhaps as a nurse or an APP. What's bringing you here today? Yeah, noticing. So we have an internal coach here for the Carillion Clinic who coaches executives and physicians. Welcome. I have another coach here. And so a coach who used to be in clinical trials. And so, yes, seeing that natural combination with medicine and coaching. Absolutely welcome. It is wonderful to have you here. And there's going to be a lot of different things that are kind of like in the background for people as they're going through this conversation that we're having today. And so we welcome your reflections and putting them in the chat. We will open up at the end for further discussion. So just as an idea of where we're going here, I always want to give folks a roadmap of where we are and where we're going. And so starting off with where we are right now with the current state of burnout in medicine, touching on what is coaching, and then getting into what is the evidence that exists for coaching as an effective intervention. And we'll talk about for what specifically around burnout, and then investment potential and the return on investment. And then also talking about different forms of intervention that are available. Dr. Morales and I, neither one of us has any affiliations with any ineligible companies. I always want to put that out there. I'm just going to plant a seed with you. Okay, this is something that's come up in conversation between Dr. Morales and I as we were talking about this presentation. And we're looking at each other going, you know, you, my friend, you're a Porsche. You are a high performance vehicle. How can we keep you in tip top shape? How can we run that maintenance? How can we actually get a fleet of Porsches to be available to us? And thinking about that analogy for healthcare and our physicians right now. All right, so for personal relevance and background, let's just quick dive into who it is that you're talking to here. So I am Dr. Wendy Schofer. I am a board certified pediatrician, lifestyle physician, as well as professional certified coach through ICF, so the International Coaching Federation. And my focus really has been on, it's an extension from my pediatric background, about the health and the well-being of the whole family. We were talking beforehand about like our introduction to coaching and how that might be relevant to this conversation here. And so I invite Renee to share hers in a few moments. Mine was actually a number of years ago. My husband is also a physician, and he is definitely the, let's just say, the more financially minded chauffeur of the two of us. And so he was like, you know, there's going to be this great summit. It's going to be about financial freedom and independence. And I'm going to go check this out. And I was like, I have no interest in anything with like real estate investments or, you know, any of that. That's your thing. And he said, well, there's this thing about physician coaching. And I looked at him and I said, what is that? He's like, well, check it out. Why don't you just like listen in? And as I go back to that story, I know exactly where I was, what I was doing. It was kind of one of those moments where I was on a dog walk listening to the recordings. And it was actually Sunny Smith, who is a physician coach that I will, you know, discuss a little bit more today. But she was presenting in this summit about the power of coaching and specifically physician coaching. And for some reason on this dog walk, I had a pad of paper and a pen. And I was taking notes along the way while I was walking my dogs with all of these different concepts that it was like I was hearing this all for the first time in my life. And yet, so many of the things that I had been struggling with in my community organization involvement, in my own personal experience, again, burnout is something that I knew well. And it was something that I had a taste and I just wanted to dive in more. And that was really where it started. What about you, Renee? What could you kind of fill people in with your introduction and perhaps your introduction to coaching?
Yes, sure. I think it was probably about 8 or 9 years ago, quite honestly. And I had heard I've heard just little bits and pieces about coaches and how they can be really, really helpful in helping people move forward. And I was like, huh, that sounds like a pretty interesting thing. I'd been a doctor at that point probably for 5 years or so. And so I was like, I wonder how you can find one of those. And I became chair of a small community department, and um, I sunk into it, really jumped into it, and there was a seminar for chairs of departments. I was like, well, I should sign up for that. And so I signed up for that, and little did I realize what I was signing up for um, was really a leadership development course. And it included not only community chairs, but it also included academic chairs from like University of North Carolina, um, the OBGYN department, and some really heavy hitters in my field. And I was like, wow. And they actually had a coach there, and he talked about what he did. I was like, there it is again. There's this coach again. How do I find one of them? They're using them. And then we had a lot of turnover in my office, and we had a lot of new hires. That always creates a bit of change, creates a bit of rumble. And so I was talking to one of the chief nursing officer. I said, we're just struggling a little bit with cohesiveness in my team, in my office. And she said, why don't you go talk to the EAP? There's a person there. Patty's her name. You should talk with her and see what she can do. She can come and do like teamwork exercises with you and really kind of build camaraderie. I was like, oh, that sounds great. And so I called, and they said, well, no, that's not really what we do, but why don't you set up a session and let's talk? And so I go and talked with her, and she's like, hi, I'm a coach. And I was like, oh, I have found the unicorn. I found the unicorn that I have been seeking. And I found her just so incredibly useful and insightful. Although the first couple times I went, I was like, what is the deal with her? Every time I go, we have this great conversation, but she's not really telling me anything. I feel like she's this for having such a great conversation, I'm generating most of it. And I was like, does that mean that she's not very good at her job, or is she brilliant at her job? Um, and so honestly, I still see her now. We've had our relationship now for I think a solid 7 years, and I found her so useful for 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 moving through life in general, truthfully.
Such a beautiful segue into that question. Is she an amazing coach, or hold on a minute, is she holding back on me?
Yeah.
Oh my goodness. And, I think that that's really kind of putting that out there. So for those that are coaching curious, for those who are not familiar with coaching, really just kind of addressing some of those questions that we've all had as we've been introduced to coaching for the first time. Like, what on earth is this? What is it not? And so I use the conversation or the description a lot that coaching is kind of like a type of conversation, is a type of communication. And it's so much more than that because it's actually a dynamic process. Coaching is describing the presence of the coach, that they are there to help clients. So in this case, if it's a physician or someone in healthcare, to help those clients facilitate their own answers. Coaches are there to ask questions and to reflect, and they always assume the wholeness of the individual that they're working with. That assuming that, they have the resources, the autonomy, the self-efficacy, that they are able to help navigate in this relationship the stressors that are being experienced. And then also to be able to assist in different ways, which again, a lot of the conversation today will be about addressing burnout, vulnerability, healing from it, the stressors that are involved. Renee, would you like to add a little bit more there?
I think the other thing that is so unique about coaching, I think I forgot to tell you, I'm a coach too. I'm not ICF certified yet. I'm still collecting my hours, but I'm certified through Wayfinders uh, coaching. And I think one of my favorite things about coaching in comparison to my job as OBGYN is that I come with all the answers. I come with all the possibilities that my patients can then choose. And in this space, I come with nothing. I come with my listening ears and some questions. And I'm not responsible for any of what is generated, but I am responsible for creating a safe and agendaless space for that process to blossom on its own. Um, I think it's such a special, such such a special relationship, and it's such a special gift to give a person.
And I hear echoes in that about how it's so very different from the way that we have been, let's just say, mentored and counseled and trained as individuals within the healthcare system. Like our training pipeline was definitely not one that I experienced coaching of this type along the way. It was more of the corrective, prescriptive type of learning, and then how that's also something that was reflected in the way that I was practicing medicine with my patients, and how there is a lot now that this, I don't know, I used the description before of kind of opening up your eyes, you can't unsee it. I can't remove that part of me now. Now being exposed to coaching, being the benefactor, the one who benefits from coaching, and that I am then able to create that ripple effect for myself, for my patients, for my family, for my clients. And so I appreciate, kind of looking at many different ways in which we can create that ripple effect throughout our lives as we are experiencing coaching. And I think that that's one of the big things that, to keep in mind as we're thinking about coaching for healthcare, how we are able to provide support and resources and facilitate this transformation for those who do this every single day, meaning they are providing support and resources and transformation for all of these patients. How critical is this to be able to support them so that we can actually do even more good? So, looking to the current state of medicine, let's just address that elephant in the room, which is burnout. Now, if you look at the prevalence of it, the most recent study for national burnout rates in healthcare reports that 45.2% of all physicians, this is 2023 data, that they are experiencing burnout most recently. And, if you look at this information that was highlighted from the AMA website, it's kind of increased and decreased over the years, but let's just acknowledge a couple of things. It is still a significant amount that physicians are experiencing burnout. And let's also kind of identify the other bigger elephant, that there's even more burnout being experienced by female physicians. So there is a gap here as far as who is experiencing the burnout, and then what is actually happening with their careers. This is also highly variable. So, looking at different institutions, looking at employment status. The other concerns that are coming up all along the way is, well, how are we retaining our physicians? What's happening? We were talking about the Great Resignation a couple of years ago. Well, what's happening with our retention rates now? And then also the state of the employed physician. So we used to have it that, all the docs would go, put out their shingle and they'd set up their own practice. And we've over time shifted to where there's so much employment of physicians. And so where is that control for career, for autonomy, for the independence of their practice, for the financial benefits that they can reap from their practice. And then there's also another kind of emerging trend with independent practice, with DPCs, with entrepreneurship, with developing the the private practice as well. And so it's different states that's all in flux, but looking at how we can support physicians. So how does your organization measure burnout? Oh, and I thank you for the word beneficiary. I now see that coming up. See, I can always use a little bit of help from my friends as far as finding those words. How does your organization measure burnout?
Or even does it? This is the other problem.
Yeah.
It might be under-recognized in a lot of organizations, truthfully.
One of those things that if we're not asking the question, we're not getting any answers. So I'm going to reference Dr. Sunny Smith several times today because she has been really I think of a pioneer in physician coaching. And she says that if coaching were a pill, looking at all of the evidence that is being collected along the way about the effectiveness of coaching, the impact on the well-being for physicians, for retention, for decreasing burnout and stress. If it were a pill, we'd all be prescribing it. Millions would be taking it. We'd have crazy, instead of Dorito ads, we'd be having physician coaching Super Bowl ads. I can only imagine what kind of fun things would come out of those ads. And it's just really been something that has stuck with me as she is saying this, that, if we just had this all bottled up and we could give it out to everybody, everybody would be going bananas on it. So I'm just seeing a comment coming in. We have a physician who specializes in the wellness of physician burnout. And we most recently surveyed our physician group. Yeah, it is a focus for us. Kudos that you have the folks that are dedicated to surveying, to supporting the physicians in the group, and then to be able to follow on that. Okay, how can we mobilize our resources? So getting into some of this data, okay, and this is really expanding the evidence for the benefit of coaching is really something that is growing, and we're going to have a resource list available to you at the end. So you can feel free to take notes, but you can also get a download as well. So really, let's look at the evidence-based interventions and what's really showing efficacy. And so this was published back in 2019. It's a pilot study that showed how Mayo Clinic was utilizing coaching as an intervention against burnout. You see that there were different specialists, well, generalists and subspecialists that were participating, and that it significantly improved emotional exhaustion and burnout, and then supporting the resilience and the quality of life. And so when they looked at the overall experience of burnout over the course of the study, those that were participating in the intervention group had a decreased rate of burnout of 17.1%, while it actually increased by almost 5% in the control group. Now, this was a 2022 publication, shared preliminary coaching data from a coaching program at Stanford. And so they were starting in 2018 with all faculty clinicians being offered coaching as a standard benefit of their employment. And so they were looking at how there was statistically significant improvement in burnout, in sleep-related impairment, and self-valuation. This is the study that, as they're part of their discussion, they're saying, hey, every physician deserves a coach. Let's look at this impact on this medium to large effect size that we're having with one-on-one coaching sessions. Now, you may say, all right, that's for employed physicians. You may say, hey, this is all, particular kind of groups that maybe we have a little bit of containment or a little bit of uniformity. Well, I'd like to introduce you to the Better Together Collaborative. So this is a organization that has been set up with, currently it's all volunteer physician coaches that are supporting residents. It started off with female residents, so those that are in medical training. And if you look at who is at the highest risk for experiencing burnout, it's female trainees, so female residents. This is a randomized controlled trial, which again, I do acknowledge that I am one of those volunteer coaches as a part of this collaborative. And this is groups online. So it's a virtual program. It started off at the University of Colorado and has been expanding over the last several years. And look at the improvement that is being demonstrated in this RCT with improved emotional exhaustion, improved self-compassion, and decreasing imposter syndrome. And I prefer to call it imposter phenomenon, but it's still something that is very well known as an experience that is shared amongst many female trainees. And so seeing that improvement through this virtual group program has really spoken volumes to saying, hey, we can address this. We can address this experience that's happening. Now, coming back to Dr. Sunny Smith again and empowering women physicians, that is the online coaching program that she developed. And so really this study, which was just published last year, shows the impact of the virtual coaching program for women physicians on burnout, fulfillment, and self-evaluation. And so really highlighting here the large effect size. So there was 201 individuals nationwide that were participating in this virtual program. And this was over the course of an 8-week program, and seeing the dramatic changes, the dramatic effects that were seen just over the course of those 8 weeks.
And so when we make the case, not only the case for it's effective, it's an effective modality to address burnout, the other question is, how much does it cost to do? And how much is it costing us, period? And so the AMA actually has the calculator that looks at, depending on how many physicians you have in your organization, what your actual cost of turnover is. And so looking at this calculator, if your organization has 500 physicians, and we don't use your institution's burnout rate, but the national burnout rate of assuming 45%, and then knowing that you have about a 7% turnover rate, not all of that is due to burnout, but a portion of it is. Some of it's due to people get a new job, their spouses get a new job, and they move closer to take care of their family, maybe their parents. And so part of that is not due to burnout, clearly. And then thinking about the cost of replacing a physician. And this is where we kind of realized, wow, we are Porsches, because the amount of revenue that's generated per year and the amount of revenue that's needed to replace us is quite large. It's estimated to be 3 to 5 times that person's salary, and so the average cost $800,000 per physician. if you're losing them regularly year on year due to burnout, you might be able to recapture at least 11 of those. And you won't be able to recapture all of them. But if you were able to capture all of them, then your estimated cost savings would be about $8.7 million per year. And so when we realized those numbers, we realized, wow, there's real money to be recollected here. And the cost of rebuilding your fleet every year is too expensive. If you think I have to buy a new Porsche every 2 to 3 years because I keep on not changing the oil, I keep on running it with diesel, I keep on not changing the tires, and I burn it out. And so then I have to find another one, and you have to think about, what are these turnover costs? Part of it is the revenue that's no longer generated by that person who's left. Part of it is the sign-on bonus that you have to give to the person who's coming. Part of it is that how healthcare works nowadays, right? You have insurance companies for most organizations, and they have to contract the organization and the insurance company, and then you have to add your employees to the contract, and that doesn't happen overnight. So it's very, very common for physicians, and also they have to get privileged at their hospital. So for all those reasons, it's very, very common for physicians to get hired and not actually start generating any revenue for 3 to 6 months after being hired. And so being employed, usually they're paid for that 3 to 6 months, and the company just has to know that that's the investment that they're putting in. The other thing is, whenever usually you come to a new company, you don't just start out at 60 miles an hour, right? So you have to use usually they're not quite as productive the first 3 to 6 months, depending on their experience. And so that's everything that goes into that big $800,000 per physician cost, that in an organization that size, if you were able to capture that, you would save nearly $9 million.
Well, and here in Hampton Roads, we have organizations of such a variety of sizes, from groups that have perhaps, 100 or so physicians up through a couple thousand. So this example is with 500 physicians and just calculating the cost of physician burnout for the organization. I think the next slide had another example with that one.
Yeah, if you have clearly a bigger number of physicians, and like, I'm an OBGYN, and quite honestly, women more often are OBGYNs nowadays. We have residencies, and currently I have 20 residents, and not a single one of them is male. So truthfully, in my specialty, I don't expect a 45% burnout rate. At minimum, I would expect a 55% burnout rate. And so when you consider larger organizations, when you consider changes in potential gender predilections of who you're actually hiring, if you have a larger organization, you could be really, really expending millions and millions of dollars, tens of millions of dollars every year, due to just burning people out. Now, contrast that with what you might need to spend to capture some of that. If you had a small enough organization, say a 500 physician practice, and you invested $500,000 a year, and you were able to decrease that burnout just 20%, you could potentially save nearly $2 million with a 247, almost 250% return on investment. I would take that to the stock market, right? Those are good numbers. And of course, as your organization gets larger, you would want to invest more, and of course your return gets bigger. And so I hope that we've made the point that rebuying your fleet every 3 to 5 years is too expensive for most organizations to sustain, and maybe even every organization to sustain. And it is a big lack of a big siphon away of money. And if you're not sure if the calculators really tell the story, Becker's Hospital Review, this is an article from November of 2021, and Cleveland Clinic were early adopters of peer-based coaching and mentoring. And so they have a well-developed program that supports their clinical well-being. And they estimate that in the year of 2020 alone, that this program saved at least $133 million by retaining their physicians. And they used the ICF's competencies when they were developing their program. And the other thing that I thought was really, really critical and something that I didn't think about until I read it in the article is that when they interviewed her, she said that 197 physicians who participated in the program, the coaching program influenced their decision to stay. And so that's big. That's really, really big. Not only are they less burnt out, but they realize that this is a value that they have in that job setting that isn't necessarily normally replicated in other job settings. And so there are a lot of different parts of medicine, and of course the AMA and the IHI is the Institute for Healthcare Improvement that have created programs that address burnout and well-being in the workplace. And I really like this wheel that the Institute for Healthcare Improvement has, and it really fleshes out whose responsibility is what. And I know that we have one coach that's doing coaching executives and physicians, another person who specializes in physician burnout. And so where does coaching fit? And I would argue that it truly fits in every single place of the model. For our individuals, you see the inner arc. As far as individual employees, individual physicians, they need to be bringing their willingness to do the surveys to measure their burnout. They need to be bringing their own wellness and resilience, which is facilitated through coaching, improved sleep, exercise, and they need to be willing to daily improve, use the systems and the workflows that are in place to create daily improvement every day. And honestly, that's the only thing that you expect out of those individuals. As far as managers and core leaders, they're responsible for not only that, but also the camaraderie and teamwork, the cohesiveness of your group, of creating a model where people participate and have some autonomy in how their workflows work the best. And I would argue that again, when people are managing other people, there's tons of room for growth that can be facilitated by coaching and helping them decide how they want to show up as those leaders. And then for our senior leaders, they're not only responsible for bringing what they bring every day, creating camaraderie and teamwork and using participative management, but they're also really responsible for the meaning and purpose. Why do these people want to work here? How can I facilitate choice and autonomy so they want to stay? How can I create a safe space where psychologically they want to be here? Recognition and rewards. What programs do I need to put forward to create those incentives to be here? Like what the Cleveland Clinic said, people knew that wasn't going to be available at other places, and so they choose to stay. And honestly, when I I kind of thought before I really kind of delved into this paper that it was my job to create my own meaning and purpose. It was my job to, and whereas that truly is true for my own life, my work life should be meaningful and purposeful as a standalone. It shouldn't be siphoning off my personal meaning and purpose. It should be giving me its meaning and purpose. So I would argue that coaching has a very strong role for all three of those individuals.
Okay, I'm just going to reflect very quickly that this is kind of switching that conversation from, I think, my early career where it was kind of like, well, you should be grateful to have this job, to really starting to look at, well, what is it that this job offers to me, the meaning, the purpose, and creating that environment as I'm hearing about psychological safety and really creating the psychological, I'll just say kind of like the seeds for us to all really thrive where we are. And as organizations like the Cleveland Clinic are recognizing their role, they're able to increase the retention because, really leaning into leaders all along the continuum, getting coaching, being able to find their role in their own personal fulfillment, as well as supporting those that are in their, kind of in their management circles, within their leadership circles. So, which aspects of the discussion, what is it that kind of like jumps out at you? What's really resonating? What is it that you have additional questions about? We're acknowledging from the get-go, there's so much more to this discussion. We're really just introducing today about some of those recent studies about the impact and the effectiveness of coaching in different settings, in different populations within healthcare. And then also looking on that at the ROI, making the business case for what was mentioned in that study before. Every physician needs a coach. Well, let's really make sure that we're bringing that home here. Let's look at the evidence for it. What resonates with you? What's the next question that you want to ask and have answered? That is a great question. So I see one coming in. Do you find that healthcare organizations are receptive to listening to this data? Well, I'm going to offer that clearly there are healthcare organizations that are. They are the ones that are helping to produce this data, to amplify it. And yes, of course, there are others that perhaps aren't ready for it, or perhaps don't see where it is something that is relevant to them, or perhaps to their current financial situation. I'd love to hear what you have to add, Renee.
Yes, I would echo what Dr. Schofer is saying, and I would also add a little bit of caution because sometimes when you're not necessarily ready to jump in and change things, when you start asking questions and even start measuring things like burnout, you run the risk of creating apathy in your employees because they say, this doesn't matter. They don't really care anyway. I don't trust them because we already did this last year and everything is the same. And so I have found that a lot of healthcare organizations are receptive, but they're not necessarily ready to jump into the pool yet. They're starting to think about it. And part of me gets that because they have to wait to the next budget. But the other part of me doesn't understand it at all because you're committed to just losing millions of dollars this year.
Yeah.
And you're not going to try to recover that at all. So part of me would strongly argue that you can't afford not to listen to it.
Yeah. And I appreciate seeing the comment that came into the chat about how one of the participants, they're creating coaching opportunities within their resident groups. And so there's so many different opportunities that do exist to be able to introduce coaching to physicians at different points within, the training and the career continuum. And a lot of times, like, it just starts as a pilot, as a trial. You're like, hey, let's just see where we can get our foot in the door. Each and every one of these studies was starting off with just a pilot. Let's focus on this particular group. Let's focus on this small intervention and see what happens. And so I think of it a lot as far as how we translate that to our own institutions, or those that are near and dear to our hearts. How do we say, hey, let's just start somewhere. Let's just start piloting and creating an opportunity for coaching and to see how we can impact these burnout rates, the fulfillment, and the retention for those at our institutions.
And I would also offer that it trickles down. It trickles down, because people who are well coached interact with their peers in a much different way. And that means that they'll interact with their nurses in a much different way. They'll start valuing what is around them in a different way, because they're seeing things with open eyes rather than through the lens of their burnt out, broken glasses.
I'm going to offer that I have not seen a study about this yet, but you're making me think that would be one crazy study to look at what is the impact on clinical care for physicians who have experienced coaching, who are, actively participating. How does that impact their clinical care? And perhaps it's out there and I just haven't seen that. But again, talking about that ripple effect, how we can have that within the healthcare system, but also the system is so much bigger than just saying within this leadership hierarchy, how it's beyond the individual teams. We're looking at direct patient care. We're also looking at, how it's impacting our lives outside of work. And so I think that there is a lot more that we can ask those questions about that ripple effect and just how far it extends. So I welcome further inquiry.
I'll offer this little anecdote because it really taught me the power of, wow, coaching has really made me come to this space differently. And I was taking care of a patient who had substance use disorder, and they didn't come to a lot of their appointments, and usually they maybe didn't have the best time at their appointments. And when I saw her and we talked about things and we reviewed and we gelled, and at the end she goes, I don't know what you did. She was a little angry about it. She felt angry toward it. And I was like, I don't know what you did. I am not usually this friendly with my doctors. Just thank you. And I was like, I was just able to provide you a container, and today was the day that you filled it up. And I wouldn't have had the skills to do that a few years ago before I really jumped into coaching myself. I realized how much it benefited me, and I was like, I need this skill too. And honestly, my reason was because I'm also a mom and I want my kids to have these skills too. And how could I give them if I didn't have them?
Okay, so this is hitting home as you're saying those words. I don't know what you just did, but thank you, because those are the exact same words that I heard in the office as well. And very briefly, it was someone that was meeting for the first time. It was a 17-year-old boy for his school physical, had to check all the boxes so he could continue to go to school the next day. And the family came in, was the father and the teen, and the father was just bringing up all the things that he wanted to make sure that his son avoided. And he started talking about alcoholism and liver disease and all these hospitalizations because he had experienced all of it. And then I found out as I was just listening that the patient's mom had died the year before. And there was so much grief being experienced in the home. Now, every single time I talk with physicians about emotional health, they always say there's no time for this. I don't have time to have these conversations in the office. But I got to tell you, I did exactly what I share all the time. I just identified it. I just said, it sounds like you're experiencing grief. And it's still here with you. And I went along, I did all the paperwork, I did all the things. I had to step out for a moment. When I came back, the father said exactly that. I don't know what you just did. He said, and yet our relationship just changed here. So thank you. And so I think that that's something, again, with these conversations that we're able to have, there are additional tools that are in our toolbox that we can create that ripple effect for ourselves, for our teams, for our institutions, for our families, for our patients. It just grows. It just grows.
And there's another question in our box. I'm a new executive leadership coach who thinks this is extremely important, but not a physician. I'm reluctant to pursue it. Will physicians only want to receive coaching from other physicians? Interestingly, the Cleveland Clinic's coaching program is not only physicians. In fact, they used ICF certified coaches, and so I believe that part of it just depends on the issue that needs to be coached. And I'm not of the opinion that my coach is not a physician, and I'm not of the opinion that that physicians will only like to use physician coach, or that they're even the best coaches for other physicians. I think that it depends a little bit on the person, depends a little bit on the topic, and I also believe that a good coach can coach anybody, because it's not about what you bring. It's never about what you bring, other than your listening ears, your presence, and your questions. And so, those are my thoughts there. Dr. Schofer, I don't know if you have anything different.
Yeah, I think that the studies that we're referencing, we have a bunch of different structures, and you will see that there are physicians being coached by other physicians. There has definitely been an expansion with physicians that are coaches. And so there's more and more available to be able to offer that service. And there's also a large number of individuals who are physicians that are being coached by others that are not physicians. So, and the studies, there's studies on either side, that there's no like head-to-head studies. It's just saying, hey, we have an impact here. We have effectiveness, and there's all sorts of different structures that are available. So this slide is to remind us that we have a fleet of Porsches at our disposal. How are we going to maintain them? How are we going to make sure that we don't have to replace them within the next 2 or 3 years? Because we have high performance vehicles right here, right now. So I did collect a number of these different resources that we've been talking about along the way, and I am going to put this in here. So I tried to make this long address as short as I could with that bit.ly, which is ROI-coaching. And this is just a PDF that has hyperlinks to those studies. And I've had a number of clients who have taken this published support list back to their home institution, and whether it's in order to support, CME funding for coaching, or even to just broaden that conversation about, hey, let's look into this a little bit more. Let's see what is possible for our organization. So I do invite you, again, that's in the chat if you just want to hit the link there, and you will get a quick download. And then I believe that otherwise, again, we've been taking the questions along the way. We definitely welcome any further questions, any reflections that you have, anything else that you would like to add to the conversation right now. And of course, you can see how to contact either one of us at our emails and continue the conversation, because that's what we do. We continue that conversation. It's never just over. So I am going to stop sharing and welcome. Were there any other questions that I overlooked along the way in the chat box? There we go. All right. Thank you so much, Suzanne. This has been wonderful. I appreciate the opportunity to connect.
Appreciate all that you've shared and the data, and glad that we've recorded this so we can share it with others. And thank you so much. And we will get this uploaded on our YouTube page for the chapter with all of the other webinars that we've provided. The link, it looks like, is coming up.
Oh, I'm sorry. May I just admit, that's a me thing.
There we go. Yes.
That was totally a me thing. Okay, so it was very wise for me to share it with the host and the panelists. So thank you. Now you should have it in the chat box. Thank you so much for bringing that to my attention.
I don't think it's hyperlinking.
No, but you can copy that. It doesn't tend to hyperlink in these. So
Gotcha.
That, one of those things, you try to make it as easy as it can be. It's still not as easy as you want it.
Have a wonderful afternoon. Thank you all.
Thank
you
you.
all.
Bye-bye.